Dr. Vanita Rahman, Clinic Director with the Physicians Committee for Responsible Medicine. So, nutrition plays a very key role in our health. A study published called The Global Burden of Disease showed that in the year 2017, 1 out of every 5 deaths could be attributed to poor nutrition. And that nutrition was a bigger risk factor for death than cigarette smoking, high blood pressure, or any other risk factor combined. So we know that nutrition plays a key role. But what's been happening around the world over the years is that nutrient-dense foods are slowly being replaced with highly processed foods that are nutritionally poor but calorically dense. And this is leading to an increase in non-communicable disease or chronic disease as we know them. Some of the challenges in nutrition in healthcare is really bringing this message to the consumer. We have a lot of great research showing how beneficial this is, but it's not translating into clinical care. So as a healthcare system, we need to bridge that gap between clinical research and patient care. The other challenge we face is our food policies don't always support healthy eating habits. They often advocate for incorporating foods into, say, school lunches or hospital programs that include non-nutritious foods. For example, hospitals often include the very foods, such as processed meat or saturated fats, that are leading to an epidemic of cardiovascular disease. And we see the same thing with school lunches. And so public policy isn't keeping pace with the science. The third challenge that we face with nutrition is perhaps cultural or personal, where people have a way of eating, and when they learn about something new, it may feel different, it may feel a little scary, but what they soon realize is that changing their way of eating actually helps them feel so much better that they don't ever want to change it back again. I think if we just take a step back and just look at what's happening in India, if you look at our traditional Indian food, it was mostly nutritious plant foods, homemade chapati, rice, millets, whole grains, and then they were usually paired with pulses or vegetables, and there were lots of fresh fruits consumed. The food in India doesn't look like that anymore. There has been an influx of Western food coming in, Western fast food, from McDonald's to Kentucky Fried Chicken to pizzas and burgers. There has been a big westernization of the Indian commercial food scene. And now people are flocking to these highly processed foods rather than their traditional Indian foods. But there's been another shift. The traditional Indian food itself is also changing from these minimally processed homemade foods to these highly processed deep fried foods such as puris and bhaturas and chaat and tikkis and samosas. There's been a rapid increase in the consumption of deep fried foods. Cheese has become forefront in many foods. Ghee has taken on a more prominent role. And as this Indian diet has shifted, so has the health of the average Indian. We see that obesity is on the rise. Nearly 30% of the Indian population is dealing with obesity. Nearly 40% is dealing with abdominal obesity. Over a third of the population is dealing with high blood pressure. Over 10% of the population is dealing with diabetes. And nearly 80% of the population is dealing with dyslipidemia or abnormal cholesterol levels. And along with this, we're seeing a surge in cardiovascular disease, in dementia, and just a rapid rise in non-communicable disease. And a lot of this can be attributed really to the way our food has changed over the decades. I think one of the most important things that we need are accurate food labels that reflect the ingredients. They also reflect the nutritional profile of foods. Now, these food labels are mandatory on commercial foods in some countries, but they may not be mandatory elsewhere. It's always it's also not always clear how accurate they are. And I think this is a real disservice to the average consumer. And sometimes the way the food labels are provided, the font is very small. It's hard to read them. Or they say as a percentage of the recommended allowance, which doesn't make much sense to the average consumer. So we really need to be very clear on the nutritional aspects of a food and the food label. And standardizing them is really key. So our team has done a lot of research, as have other teams, and the evidence is really supporting the same conclusion that plant-based diets can help patients improve glycemic control, reverse their diabetes, lower their blood pressure, drastically decrease their cholesterol levels, improve their overall health and energy, and all of this without resorting to necessarily expensive medications or invasive procedures, just by changing the way that they eat. And research has also shown that eating plant-based foods is actually more economical. It saves the average consumer money compared to non-plant-based options, and it is better for the environment. The greenhouse gas impact of animal agriculture is significantly more than that of plant-based agriculture. The Physicians Committee for Responsible Medicine is a nonprofit organization. We are headquartered in Washington, D.C., and our mission is to educate healthcare providers, educate the educators, and communities at large about the importance of nutrition in disease prevention, management, and reversal. Specifically when we're talking about plant-based nutrition and the powerful role that it plays in our health. We conduct clinical research. Our research team has published dozens of research articles in peer-reviewed medical journals. We've conducted dozens of clinical research trials showing how beneficial plant-based nutrition can be in reversing or improving chronic conditions such as diabetes, high blood pressure, cholesterol levels, rheumatoid arthritis, or other autoimmune conditions. We are also looking to improve ethical research standards, so advocating for the use of non-animal teaching and research methods, because these methods are more accurate, they're more in line with ethical practices, and it decreases animal cruelty. And our goal is to help change public policy so that schools are providing nutritious lunches to students, hospitals are serving foods that can help improve patients' health, and that medical school curriculum includes nutrition and lifestyle as a key core aspect, whereas right now it tends to be more in the fringes. As part of our mission to educate healthcare providers and the future students and leaders in the country, we hold a national conference every year in Washington, D.C., where 500 to 1,000 healthcare providers attend. And the leading research scientists and medical professionals from around the world lecture at this conference and provide the latest research evidence about the role of nutrition in disease prevention and management. Absolutely. So with collaboration with other organizations, New York City has now made plant-based meals the default meal option in their 11 public hospitals. And this is a huge benefit to the patients that are getting care there. New York City has also introduced plant-based lunches for the students that attend the public school system there. We have also helped students successfully sue a school district for mandating that dairy products be served at school lunches and not allowing students to express their opinions about what might be healthier options. So change is happening, and we are also making a lot of outreach to the American Medical Association, which has now come out in favor of plant-based nutrition as an option in patient care and disease management. We've been advocating for the use of non-animal-based teaching methods in medical education and veterinary education. Recently, due to lobbying efforts from the Physicians Committee and our supporters, 2 veterinary schools in the state of Alabama specifically Auburn University and Tuskegee University, have stopped performing cruel experiments on animals before killing them.